Hello everyone, I'm going live today with Anna and Patricia from Procrear Fertility Clinic based in Portugal to discuss egg donation with IVF abroad in Portugal. We get lots of questions on this, so it seems very fitting to have their expertise here today. We've had a few technical hiccups, so hopefully they'll be able to join now so that we can answer questions from you guys, which will be hugely insightful for your journey wherever you are, especially around egg donation abroad and in Portugal. Hello.
Hi.
Can you see me now? Wonderful. We are here. Fantastic. So I've just thanked everyone for their patience. If you could please just start by introducing yourselves, Procrear Clinic, and also your jobs, what you do, before we start talking about egg donation in Portugal with IVF.
My name is Patricia Rocha. I'm one of the nurses at Procrear Clinic. So we're located in Porto, in Portugal. We are a fertility clinic, and my main role this last year, it's been coordinating the donation program. I have Hannah with me.
I'm Anna Wiesen. I'm a clinical and health psychologist at Procrear, and I work in donor assessment as I work with patients undergoing fertility treatments.
So please tell us a little bit about the egg donation process at Procrear. How does it work?
I was saying I'm coordinating the donation program. So we start from the very beginning when our donors apply through our website. So there are our candidates at that time. We do the first initial screening just to try to rule out any reasons why they would not be suitable to actually donate with us. And then the other part of my job is to look for the best match for the couples we have receiving treatment at Procrear, and try to allocate them together with the lab team. Obviously, we review a lot of things, not just the physical characteristics, but we have access to a lot of information. Sometimes we might not be able to share this with the couples, but yeah, we review quite a lot of things when we actually allocate a donor to a couple.
How are egg donors screened psychologically at Procrear?
Yeah, so we can just explain some from the very beginning. We screen the candidates that we receive, and then they have a first medical appointment. And that's when we go through all the medical history, family history, height, weight, if they donated before, all of these things that we go through. We do an ultrasound and make sure everything is okay for them to proceed. And then they go and they see Anna for the psychology screening.
Yes, a psychology screening is very rigorous because we need our donors to meet our higher standards. So basically, what to start? The beginning, we focus on their life story and we try to understand their motivation behind being a donor. That's very important. And we try to give them as much information as possible so they can understand all the process of the donation. And they understand if they have the availability and the responsibility to carry them out. Then we talk about some ethical and legal assessments. They are very important, like confidentiality and non-anonymity. And then we assess their mental health. We talk about their mental health status and their family history too. We use some tools, instruments in tools, psychological tools, like to understand their emotional intelligence and their personality traits. This will basically help us to have like a very detailed profile of our donors, like some obviously physical characteristics like Patricia was saying, but also emotion, intelligence, and personality traits. We also try to understand their hobbies, their interests. We have some trivia questions, and at the end we ask for like a little message from these donors to the future families, and basically this whole process makes sure that our families get these profiles and helps them make a good decision about their donor.
And why is Portugal such a popular destination for egg donation and IVF, growing in popularity, in fact?
Yeah. So we think, for starters, Portugal is a wonderful country, of course. very safe. Obviously, it's very affordable as well, and very easy to travel to from when you're from abroad. At Procrear, we have a multidisciplinary team. We speak several languages, and I think this helps us build a strong, personalized relationship with our clients, with our patients. And I think that's the main mission of Procrear. We try to be different because of that. We try to actually have, know the patient's names, know the patient's history. We try to have one medical doctor allocated to the patient throughout their journey. We try to have one member of our international patient coordination team allocated to the patient as well, from the very first contact all the way until they have a baby in their arms, hopefully. So we try to make this relationship very close.
Are there specific laws, regulations, process that people should be aware of when exploring egg donation in Portugal? And what should intended parents know about the legal and ethical process in Portugal with egg donation IVF?
Okay, so regarding the legislation, we were talking about it. So I think the main thing in Portugal is that we are monitored by the National Art Authority. So all the information regarding art treatments done in Portugal needs to be documented and monitored by the state. So they're very, very transparent about this. And they really make sure everything is, all the information is collected and it's there and it's been saved for, a long, long time. Then we have quite an open and permissive attitude toward IVF treatments. We're getting better every year, we hope. And this is a good thing because we can also offer treatment to single women and same-sex female couples. It's a big community at Procrear, and we're very proud of that. Regarding donations, our donors are non-anonymous, like Anna already talked about. We think this policy safeguards the child's right to know information about the donor, but also allow us to protect our donors, give them clear guidelines about the number of donations they can do, their compensation, the whole donation process. We found that most of our donors are motivated to actually help other people, because if we think about the amount of time they spend coming to clinic, being monitored and all of these things, and if you compare it to the compensation they get, they do this because they really want to help. Also, it's very important for us. They understand they can be contacted by their offspring once they turn, once the offspring turns 18. And they also allow us to share some information on the extended profiles that Anna talked about. So all of these things allow us to have a large pool of donors in Portugal, in Procrear, one of the biggest. And this allows us to offer treatments with minimal waiting times, actually none, and to keep our prices affordable for patients. So it's quite a good thing. So what can we do when we help our patients to actually choose an egg donor? So the main thing is right from the beginning, our international patient team and the medical doctors, they speak with the patients, they try to understand what are their expectations. When the time is right, they're sent to the donation team, and we review all the donation process with them and try to get their expectations, try to kind of manage this, because sometimes it can be quite difficult. And then we try to select the best match that we have available, and we propose them to the patients with these extended profiles. If the patients feel like it's not the right match, we can look for another option and we can speak about it. At Procrear, we offer genetic matching. We can do a genetic matching up to 2,200 genes studied with our donors and compare it to the patient receiving these eggs. And we have also been doing, since last year, the immunological matching with a test called KIR test. And this allows us to try and give the best prognosis to our patients with an egg treatment.
Great, thank you.
I will probably proceed with how can we help parents prepare emotionally for these treatments. We know that IVF can be challenging especially emotionally, physically also too. So there's some maybe some strategies that can be useful. Like I would say it's crucial to be well informed even before starting the procedures. People should know all the procedures, should know what an egg donation entails. It's important for us to understand these patients' values, and try to understand that sometimes this is not their first option, that they didn't want to go through a donation, but they need to feel comfortable about it, so they can be basically like living with this decision peacefully. So we make this work with them. Seeking psychological counseling can be fundamental, and at Procrear we offer this support to all of our patients during all this treatment, like at the beginning, during the treatment, and even after treatment, to deal with some challenges that can be they can find. It's always important for these families to have like a strong support system, like friends and family that they support, and also they can look for support groups even online, so they can feel like there are other people that share the same insecurities, the same problems as them, and have similar experiences. Also very important to take care of their health, physical and mentally too. Even balance their diet, their exercise, their lifestyle. This is very important. Sometimes even practicing some stress reduction techniques such as meditation, yoga, mindfulness exercise that can help maintain a calm and clarity during all the process. It's also important to work with a couple, like work the relationship, work on the couple's relationship. I'm sorry, like active listening to each other, maintaining the couple's interaction and connection, making plans together. Life shouldn't be all around IVF, but life should be within the couple. They should be able to have all these couple moments. So adjusting expectations together too, understanding each other's limits that sometimes may be different, and even some points of view. That's very important for them to keep the communication alive. And also we help them managing expectations. Sometimes it's very important to be prepared for the emotional highs and lows of the process, and have some realistic expectations can help to better cope with some situations that arise.
Thank you.
I think that we should talk about the open ID approach, right? So in Portugal, we have the confidentiality that basically these families, they don't know who are they receiving from, who is their donator, or is a donor, I'm sorry. And the donor doesn't know to which families they are donating to. Also, however, from 2018 in Portugal, we have a legislation that guarantees that a child that is born through sperm donors or egg donors, they have the right to request information about their donor identification when they turn 18. So the disclosure of the donor information is entirely controlled by the family. Ensure that they share the information that they prefer in their own way, on their own timing and on their own way. So this guarantees that they never revealed by accident. And at Procrear, we provide to these families, obviously, psychological profiles, like I said before, of the donor, that this gives them a little bit more information about what to expect. But it's always important to say, be very conscious in creating expectations about this donor and potential contacts. And also we provide psychological counseling to help these parents, these families, to go through this journey of disclosure too. Okay, I can go through the next question. I think that it's about the emotional support and the counseling that we offer at Procrear. And we have psychological counseling and support for parents in any phase of the treatment. And there are some key aspects about this support. First, I would say always help them managing stress and anxiety. We know this population can have high risk of anxiety and stress. So before, during treatments, while waiting for the results, sometimes these are very eventful situations that may arise some stress. And we try to help them dealing with expectations too. We also provide a decision-making support before treatment, like working on this, like acceptance of the donation, okay, to facilitate the process even on genetic mourning. That's for some couples is very important. Deciding either or not to have treatments, what are other possibilities, when to stop, when to start another treatment. We assist families deciding how and when to disclosure the donor information, emphasizing that this is their choice, if they want to, how they want to, and when they want to do it. So we can also help improving the communication in couples relationships. Like I said before, that is very important to strengthen the relationship. That's the base. And build always a support system and preparing for different outcomes. We help setting realistic expectations, even exploring some alternative options if needed. We also have to address, in some cases, grief and loss, providing a safe space for them to process all these feelings, all these emotions, and give them time to make decisions, not to rush them, and always prioritize their mental health. Our counseling basically helps making decisions, understand the implications of donation, managing stress of the treatments and the results, and we support these couples working through their challenges and different points of view, ensuring that basically they are emotionally prepared and supported, feel supported.
Yeah. So I think from the things we talked about before, just to give you an idea of if you're actually looking to have treatment in Portugal and at Procrear specifically. So how long would the patients need to stay in Procrear, or in this case, to stay actually in Porto? So we review the treatment plan with the medical team. As soon as you actually start your treatment, you also have the nursing team in touch with you directly whenever needed. So throughout the process, you're always in touch with someone. So we have been able to closely monitor all aspects of the treatment with the patients abroad. However, some of our patients prefer to come and have the ultrasounds, the monitoring ultrasounds with us. But if you can't, if it's very difficult to book flights and stay here for a longer period, it's completely fine. We just need to make sure you have your medical doctor or gynecologist that can perform the ultrasounds, and that they know what they're doing, and they can give us a full report for us to be okay with it and to make sure we can make a treatment plan around it. So if everything goes to plan, the patients only need to travel on the day before the procedure, so the insemination of the embryo or the embryo transfer. We always recommend them to arrive the day before. We've been having some issues with the flights. Flights are canceled, are delayed, and then patients are not here, and it's very sad for everyone. And then so we ask them to arrive the day before, and we ask them to stay for at least 48 hours to make sure they have time to rest and recover, and it's safe for them to travel. Then we have the follow-up care for at least 2 weeks after, and that's when they do the blood test to check if we've got a positive result. And if it is positive, they'll have the clinical ultrasound until the 12th week of pregnancy, and then we give you the discharge and you have your baby. And yeah, so I think that's the main things around the egg donation process at Procrear.
Thank you. If anyone has any questions for the team or wants to know more about the Open ID opportunity for egg donation within Portugal, please do head to our link in bio to learn everything and get in touch with their wonderful team who are full of insight and expertise.
You have all of the information about the treatments we do in our website, the ProCare website, and our social media as well. Anything you would like to ask, just please send us an email, submit a form in the website, and we will be able to help you. We've been doing quite a lot of treatments with patients abroad, and things have been going really well. So hopefully we can help you, and we're all here to help. That's our mission. So please let us know if you need anything else.
If you want to learn more about the process involved in travelling to Portugal for egg donation, IVF treatment in Portugal, then please do DM us or contact their friendly team with the link in bio. Thanks everyone, great to see you.